Hi everyone, my name is Dr. Igor and you are watching On Pulse channel. Today we will talk about the cytokine storm caused by COVID-19, about how coronavirus destroys our lungs, blood vessels and internal organs, and how it kills. At the end, I'd like to tell you what, in my opinion, you can do at home to prevent COVID exacerbation and turning into severe form. And also, if someone had contact with COVID patient. COVID-19 infection usually involves massive inflammation, affecting primarily lungs, but it may damage other organs as well. This severe inflammation is caused by excessive immune system activation. Inflammation is our natural defense mechanism when it is controlled, but it often becomes overwhelming. And this happens not right away, but after about a week or two after the first symptoms. Imagine that this is our cell having on its surface specific proteins called angiotensin-converting receptors. These proteins are abundant in many tissues, especially in the heart, lungs, kidneys, and in the gastrointestinal tract, GI tract. They control the vascular tone, determining how narrow the blood vessels are, helping to keep the desired blood pressure. Their second function is the control of immune response. In particular, they are able to lower the immune response, to suppress it. It is known that COVID-19 binds these receptors in order to get inside the cell for reproduction. Imagine that the viruses occupy most of the receptors on the cell surface, and therefore no free receptors are left to do their normal function. Therefore, vascular tone can't be regulated properly, with resultant narrowing of blood vessels or vice versa, their expansion, collapse, shock, drop of the blood pressure. Liquid from blood vessels may start to move outside through the dilated vascular walls, causing swelling, discharge and hemorrhages. From the other side, lack of free ACE receptors leads to uncontrolled immune response with excessive inflammation and damage. These are small viruses inside our cell that used ACE receptors to get inside, and now they are easily replicating. Interestingly, the second phase of trials is going in Europe currently, where the patients received human soluble recombinant ACE2 receptor. That means these receptors were artificially synthesized, they were injected into patients and began to swim in the blood. The virus gets cheated, it thinks that it is the receptor it needs. COVID-19 binds these swimming proteins and can no longer disconnect from it or join the others. So the manufacturers of this drug hope to trick the virus so that their synthesized ACE protein would act as neutralizing antibody. Because if the viral spikes are blocked by the artificial receptor, it can't infect cells and becomes totally useless. Well, good luck to the guys. This drug is called APN-01. RHS ACE2 means recombinant human soluble angiotensin converting enzyme 2. The second mechanism of COVID-19 aggressiveness is the cytokine storm. In general, the uncontrolled activation of immune system occurs with a massive inflammation that doesn't stop by our normal control mechanisms. Our body has immune regulatory mechanisms that modulate our immune response and inflammation, but unfortunately, this is not happening here. A cytokine storm is observed only in some patients, and we cannot predict what factors are important. We don't really know when and who will develop the cytokine storm. This is a very serious condition. To understand what it is, imagine that we have several those lymphocytes and each has its own shape of receptors through which they recognize the foreign proteins and which they use to bind these specific antigens. This one is square shape, this is round, and this one is triangular. Of course, it's very schematic. These are cells that were developed some time ago when some viruses or other foreign agents got into our body. They were made by our immune system, and these lymphocytes are specifically trained fighters against that pathogens. They remember them and ready to kill that microbes. Let's say that virus gets into our body again, and it has the square proteins on its surface. This is the macrophage, which is a part of non-specific immune system, it comes to a place where the invasion occurred, to the damaged region, it eats the virus, breaks it into pieces and exposes the viral particles on its surface to introduce them to immune system. This macrophage goes to the lymph node, where there is a school for naive virgin lymphocytes. They become trained, activated against the specific virus. In our case, it shows the viral parts and shouts, "Hey, there is a threat! Please come and help fighting!" If we already met this virus before and have trained memory cells with the same shape receptor, they will quickly start to divide, to train a new army of special forces. They multiply, rush around in all areas of the body to find the foreign agent, bind it and neutralize it. That means that only one special line of T lymphocytes must be activated in response to the virus, as it is shown here. The lymphocyte with square receptor that can bind specific virus has multiplied and started to neutralize the virus. Why does the cytokine storm occur? Usually the mechanism is the following. Usually the reason is the presence of superantigen, and COVID-19 may be this superantigen. As we see, superantigen binds the receptor not at the specific site, this round or triangular or square, but at the outer part of the receptor, meaning that this superantigen can activate any kind of these receptors, making all T lymphocyte lines to multiply and to mobilize. Not just one specific line against one virus, but against many of them. Thus, usually one virus activates thousands of T lymphocytes, but in case of superantigen, it activates millions, all of which will become active and release huge amounts of cytokines and pro-inflammatory substances and cause massive inflammation and severe damage to organs. They will attract neutrophils, the other immune cells that will come and release very aggressive substances and free radicals that will further damage the tissues. The vessels will dilate, the blood pressure will fall, the patient will develop shock, all organs will get low oxygen and become hypoxic. We observe massive destruction of the lungs. First we see the typical viral pneumonia appearance of ground glass, but later it looks like usual bacterial pneumonia. And finally, if the patient survives, it leads to the formation of pneumofibrosis, the formation of scar tissue inside the lungs, the non-functional one. And everything will depend on how much of the lungs were damaged, and if the patient survives this critical moment when the cytokines are released and when the blood pressure falls and when all the organs have oxygen deprivation and when we get a lot of thrombosis. Disseminated intravascular coagulation syndrome may occur when there is a massive formation of thrombi inside the vessels, and then when coagulation factors are depleted, the patient gets a lot of bleeding. And the third mechanism. This is the macrophage that ate the virus and digested it into parts. And it starts to produce interleukin-1 and interleukin-6 itself. These interleukins will produce fever, and also interleukin-12 will activate T helpers. T helpers activate cytotoxic T lymphocytes that will go to the lungs, they will kill cells infected with virus and cause massive inflammation and a lot of free radicals, further damaging the lungs. Interleukin-1 is also a chemotactic agent, meaning it attracts immune cells into the problematic zone and causes further damage to our organs. Interleukin-6 is also a very potent pro-inflammatory cytokine. For example, sarilumab is a drug against interleukin-6 that is widely studied in COVID patients currently. Neutralizing interleukin-6 will help to decrease inflammation and damage to our organs. This drug is quite expensive and is used in more severe cases. So, what should we do? Three types of treatment exist. First is the treatment of cause. So, we have to influence virus somehow. But we don't really have any effective treatment against viruses nowadays. So, the second step is pathogenetic treatment, and the third one is symptomatic. What does it mean? To treat symptoms. If we have high fever, headache, we can just take Tylenol. This is symptomatic. Or nose drops for impaired nose breathing. Our main target in COVID-19 infection treatment is the second step, between the cause and symptoms. We have to target all this sequence of immune and inflammatory events in our body, to decrease cytokine storm, to decrease inflammation, and to try to make our immune system calm. And now we are coming to the topic. What I promised you, I will tell you what, in my opinion, we can do at home, what is easy and inexpensive. This is a very interesting topic of free radicals and antioxidants. It has been studied extensively recently, but there are still many questions we don't understand. All the studies show quite mixed and controversial results, and I was speaking about it in details in my other lecture about cancer and antioxidants. If it's interesting for you, please watch it. Free radicals are the molecules missing one electron, so they're searching for it, they are very aggressive and they're trying to get it from anywhere they can. So they can get it from our cells, they can get it from the membrane, from nucleus, damaging the cells, causing their death and suffering and causing inflammation and cancer. Antioxidants are the donors of electrons that can provide electrons for free radicals and neutralize them. So they are antidotes for free radicals. During our life, many factors and infections and stress, they all produce oxidative stress, meaning that free radicals are formed. Every area of inflammation has a lot of free radicals that damage everything around. And when we have antioxidant deficiency and abundance of free radicals, this is called oxidative stress. There is other situation when there is too much antioxidants and low levels of free radicals. This is called antioxidant stress. This is not very good also. Why? Because free radicals are not always the bad guys. Our body may produce free radicals to fight with some threats, for example with infection, with tumors. Thus, we need the balance. How could we reach this balance? The mildest and the safest way is, of course, diet. Eating food rich in vegetables and fruit and food rich in antioxidants may help. And I'll show you the table with food sources of antioxidants in the end. I never recommend to buy these antioxidant powders or pills that you can buy in food stores or in over-the-counter, because they are too concentrated and they can cause antioxidative stress. It's totally understandable. Can you imagine, our body is producing free radical to fight tumor or virus, and we give these antioxidants to neutralize free radicals, and the virus and tumor will say, "Hey, thank you, we can grow now and we can divide." In my lecture about cancer and antioxidants, I'm telling about many studies that show that if the patients with cancer get antioxidants, they have worse results than if they don't get them. This is not true if speaking about the natural antioxidants coming with food. But in the case of COVID-19, we see how abundant the inflammation is, and the inflammation means free radicals. And our immune system will produce these abundant numbers of free radicals to kill infected cells, to kill viruses, but also, unfortunately, it will damage the lungs, the blood vessels and all our organs. So I think it is the only case when you can take these pills with antioxidants. If the patient has already developed the symptoms of coronavirus, we have to stop the inflammation and stop the damage to the organs, preventing the severe course of this infection. Prior to the critical moment, we have to refill the antioxidant stores of our body. Neutralization of free radicals would potentially prevent damage to our lungs and internal organs. I'd like to warn you that this is only my theory, not the official recommendations of COVID treatment. Taking into account that we don't have really effective treatment of COVID-19 infection, this is quite logical to try this scheme also. And of course, short-term intake of these antioxidant pills won't make any harm to you. And here's the list of food containing antioxidants. As you can see, the most rich in antioxidants are green tea and pepper and coffee, curcumin, cinnamon and others. Red wine is good because of resveratrol, which is contained in grapes. And don't forget, if you have symptoms, you can always take antioxidant pills. And of course, don't forget to take berries, fruit and vegetables. And this is the scheme from my lecture about autoimmune diseases and natural compounds. I forgot to tell you that the drug I was talking about, which is used in COVID infection, which blocks interleukin-6, is also used to treat rheumatoid arthritis, for example. What is that? It's an autoimmune disease. Autoimmune diseases are the group of diseases when our immune system becomes overactive and damages our own tissues and organs. This means you can try to use any natural compound from this lecture to treat COVID-19. You'll see the link now. And here you see T helper is producing interferon gamma. And interestingly, these T helpers, they produce other substances that activate new T helpers. So this is a vicious cycle. T helpers become abundant and they produce even more T helpers, and this never stops. Normally it must be stopped by these T regulatory lymphocytes that are deficient in autoimmune diseases, and they seem deficient in some patients in COVID-19. So we need to increase T-reg and decrease these guys. And the substances that are able to do this are in the lecture about autoimmune diseases and natural compounds. This can also be used in COVID-19. So, let's be active, be in a good tone, train our heart, lungs, do exercises, drink enough water and follow healthy diet. If the information was useful for you, please like the video, subscribe and be healthy. Goodbye.